Because I have been in a general practice for a very long time, I think having a trusted GP is an important part of the pregnancy journey. And so establishing a relationship with a GP when parents are considering a pregnancy, I think is definitely worthwhile, and maintaining that relationship throughout the pregnancy and beyond, I think is also an important part of that quality of care that we can offer. I think it's very important that the information going to parents is in an unbiased manner. It's sometimes very difficult to do in the limited time that we have available, but trying to explain to the parents what their options are without any judgment about any decisions that they may make in the future, but making sure they're aware of the fact that electing to have those tests will mean that they'll need to make some decisions later on if there was a high chance result or a variation in the test result that they needed to deal with, expressing that there has been some variation found in those chromosomes, the implications that may have. That may not be clear, and that's the hardest thing to describe to parents, is there's been this variation, and we mostly, for most conditions, have some idea of what that may mean, but we don't always know all the answers, and that's also a difficult thing for patients to understand. Why don't you know all the answers, and how can I get more information?
Communicating with your patients is something you've got to work really hard at. You've got to give families your time. We're all busy, we're all rushed a lot of the time, but it's really, really important to make sure you take that time. I think engaging with organisations like DSQ is essential if we're going to make sure that we support individual patient groups, but also help to change the way people see these conversations. Well, I think the first thing for a health professional is to actually, first of all, make sure you're prepared yourself, have time. That's the biggest one. I think that's what we do wrong a lot of the time, is where we're rushing it. Don't have your pager, don't have your phone. They've got to be put away if you're going to be having these kind of conversations. And I think my approach is keep it simple. Families won't remember lots of information when they're having these kind of difficult discussions. They are difficult, whichever way you look at them. Be honest and get as much exposure and as much experience as you can doing them. The key thing for us is to be really open with what we say, really clear, and I think the information has to be able to provide all the different dimensions of what goes on for a child with a genetic syndrome. You know, we could paint a really rosy picture, but the reality is it's not always going to be like that. Similarly, we can paint a really negative picture, but that's not the case either. So I think we have to be really aware of how we portray that information at a time when parents are feeling really overwhelmed.
I think sometimes when we receive unexpected news at any stage of a pregnancy, sometimes it's easy to stumble over that information. You know, maybe the healthcare provider is wondering how the person's going to take that news. They're obviously potentially going to be supporting somebody who's in shock, feeling very overwhelmed, might be quite emotional. So I think sometimes as human beings, we tend to just keep talking and maybe say things that perhaps shouldn't have been said, or may have been said a little bit awkwardly. And that's okay, that's human nature. But I think what is important is that aspect of trust is built so that the patient can always go back with more questions to their healthcare provider. Their healthcare provider can give them a range of different places that they can get additional information. And I think the other reason that it's so important that these conversations are done well at all stages of the journey is that in my role, what I hear from families when this news is shared poorly is ongoing trauma and distress that really impacts the rest of that pregnancy and even beyond birth, to be honest. So I think if we can achieve even just better communication through the information that's available through the resources and the site that we've developed in this project, I'm really hopeful that future parents who are in contact with me are just wanting to find out more about life with an extra chromosome rather than having to really unpack and process the additional strain that poorly shared news has created.